Hello, Ro. What brings you here?
Hi. I just assist people by providing them vital information which they may not be knowing.
What kind of information I want to know?
Generally, people are very shy when it comes to the affordability of medicine. Some people skip their medications or not following prescriptions due to financial barriers or just forgoing daily needs like groceries, etc. to compensate medicine requirements.
What are the solutions? I never thought of this.
There are various solutions available, though they may not work for all but may be worth exploring rather than sitting sick at home.
What are those?
Firstly and foremost is ask your doctor. Open communication skills with your doctor about medication is cost essential. Patients should feel comfortable discussing any financial concern they have so that doctor can take those into account whenever treatments are recommended. Doctors do have samples provided by pharmaceutical representatives which can be help in starting a new regimen without incurring full cost of prescribed medicine. Formulation considerations as an alternate can be very useful. The doctors may consider insurance formularies and coverage options when prescribing medicines. This ensures patients have access to affordable options covered by their insurance plan.
Oh, you know so much. I have not seen anything like this before.
Second important part is pricing. Comparing pricing is a crucial element as prices vary from company to company. You may use online tools to find the best deal based on prescribed medicine. While buying, make sure to choose a reputable platform licensed by government. Pharmacy markup play a role of dynamic pricing, therefore larger companies may have more negotiating power with manufacturing or wholesalers to offer lower rates. Since pharmacies buy on wholesale market, therefore prices are according to that also. Demand and supply can result in fluctuations impact on pricing threshold limits.
Oh, I see. What about discounts?
Websites, pharmacists and apps offer discount cards and coupons that can significantly lower the costs at participating pharmacies. Discount programs and loyalty cards can lower the out-of-pocket cost for medication based on eligibility criteria. While conversing with stakeholders, you must inquire about discounts, generic options, price matching policies. Some companies may be willing to match price offered by other competitors.
I hear a lot about generic medicines. What is that about?
Generic medicines options are being produced everywhere now as an option to branded ones, as they offer lower price, but are required to be bioequivalent in terms of ingredients and quality. As your doctor if generic equivalent is available for the prescription. Generic medicines have made a global impact to healthcare by making essential treatments more affordable, accessible especially in developing countries. The generic medicines are cost-effective because they do not have to repeat costly clinical trials in comparison to branded ones. Generic medicines manufacturing company has to comply with good manufacturing practice regulations, which requires rigorous testing to prove that they are safe and effective as branded ones.
Oh, very interesting subject.
Next in line is patients' assistance programs offered by various pharmaceutical companies. These programs can offer lower price or even free of cost medicines based on eligibility criteria. You can also check with your doctor about this one. Eligible patients who meet specific criteria, such as low income level or medical necessity, can take the benefits.
Oh, I see. You may continue till my doctor arrives.
Government programs can be a game changer and are available in various countries. Government programs can be in the forms of subsidies, discounts, and are applicable to lower income level, seniors, and people who have disabilities. You may always check the eligibility criteria for this benefit, which requires good search.
What about charities? We hear a lot about them.
Charitable organizations and non-profit organizations may provide support or resources for accessing affordable medicines. They may assist in navigating healthcare systems and accessing subsidies if available. Charitable trusts also run programs and offer services based on discounts or even free. Besides this, you have advocating groups also who come forward for assistance. Some online companies offer virtual consultations, providing an added layer of convenience and professional advice.
What is this splitting pills?
In some cases, medicines can be purchased in higher doses and split into smaller doses under doctor's direct supervision. Further, over-the-counter options can also be explored, as in some conditions this can be cheaper than the prescribed medicine. You may discuss this option with Dr. Tu. Interchanging options to generic medicines can also be part of this. Some doctors do have access to prescriptions discounts or vouchers, which also can be suitable or requested.
Does education and awareness play a role?
Both patients and healthcare providers should be well educated and equipped about the availability and benefits to make informed decisions about treatment options.
I live in a remote area. Does it make a difference?
Price vary BSET on cost of living, therefore based on competition it may be either higher or lower, but majorly urban areas have lower prices compared to rural due to overcapacity of suppliers.
So I may summarize that by working closely with healthcare providers, one can explore various options to manage medicine or hospital costs effectively while receiving appropriate treatments for any medical condition.
Correct. By exploring the spelled out practices you can often find ways to make your medication and hospitalization more affordable without compromising on quality or effectiveness. Thank you.
Thanks you so much. I will share information with the needy.